Hey friends, welcome to a brand new series on the Wild Rebel Wellness Podcast. After hearing powerful stories from women who've not only maintained their weight loss after bariatric surgery, but also took bold steps to pursue care outside of the US, Healing Beyond Borders is about exploring the world of medical tourism, the choices, the challenges, the life-changing outcomes that happen when you step beyond borders to take health into your own hands. We'll talk to patients, doctors, and industry insiders to uncover what's really happening behind the scenes of international care and why more and more people are saying yes to healing in other countries, to the adventure, and to the sovereignty. It's your choice, and you can make whatever choices are right for you. If you've ever wondered what it's like to seek surgery, dental care, or even the healing of a wellness center abroad, this is the series for you. Let's expand what's possible, and let's heal without limits. Hi, everybody. I'm so excited to bring you my first guest in this new series, Healing Beyond Borders. Today, I got to sit down with Dr. Illan. Dr. Illan was my bariatric surgeon who changed my life 7 years ago. And he's changed the lives of my friends, my coaching clients, and lots of people in the 17 years that he's been doing bariatric surgery. I am so excited to bring this conversation to you because he really helps us to understand what we need to know when we decide to seek surgery, seek care outside of the US. There's lots of information that we should be researching, and he helps us to understand what some of those key points are. So stay tuned and enjoy my conversation with Dr. Illan. Hello, Dr. Illan. It's such a pleasure to have you here today. Thank you so much for making time. I do appreciate it.
It's my pleasure, DeDe. Thank you for having me here with you, and thank you for your audience. And it's going to be, I think it's going to be a great talk between us. So anything I can do to help and get information about bariatrics process. So yes, thank you for having me here.
Sure. Well, I just wrapped up a series, my first series on this brand new podcast called Successful Maintainers for women who had bariatric surgery, lost at least the bulk of their weight, and then managed to keep it off for years. And just really that group is always very inspiring to me. And I'm always curious to know what their tips and tricks are for having just changed their whole life. But in the process of those conversations, it came up that several people ended up having bariatric surgery in Mexico. And
Correct.
Some of us had it with you. And so I thought,
Yes.
well, this is a perfect opportunity to go straight to the source and see, a little bit more about the choice that people end up making to have surgery in Mexico. But one of the things that I wanted to find out to get started is, and I've been so looking forward to this because I've never really had this opportunity to just chat with you and find out why bariatric surgery? How did you come to be a bariatric surgeon?
So actually, it's a very funny story. Actually, my whole aim since I was a med student is to be a plastic surgeon. So actually, yes, that was my whole goal. So I want to be a doctor to be a plastic surgeon. And actually, I managed to go into that specialty and I did quit plastic surgery residence 6 months after I get in. So it was a very hard time because a lot of my mentors and teachers did support me to become a resident of plastic surgery. And at the end, I wasn't happy in the OR doing plastic surgery. So maybe a lot of surgeons, a lot of peers or colleagues are not going to understand this, but I think a small group, they're going to be identifying with me that if you're doing something that doesn't fulfill you or makes you happy, the outcome is not going to do great. And yes, and eventually it was a hard decision for me to step out of plastic surgery. And in between that time, I was talking to a mentor, and actually that mentor was Dr. Rutledge. He was the inventor of the mini gastric bypass. And that's why I have a great appreciation from him. Unfortunately, he passed away a couple of months ago,
Yeah.
But he was the main reason why I became a bariatric surgeon. So yeah, so that's my story.
You mentioned him, in your Facebook group, and we're going to talk about your Facebook group because I absolutely love that page, and I love some of the new content that you've been sharing too. So I want to get to that, but first, I just wanted to acknowledge Dr. Rutledge and really share how inspiring he, has been for you and been involved in this phase. So I want to, thank him for directing you to this path, because it seems like you said, when you do something that love, everything seems to fall into place.
That's
And to the
correct.
other
Yes.
on the other side, when you're not, it just doesn't fall into place.
Yes.
Whatever
It
it
didn't
took to
feel
get.
it didn't feel right. It didn't feel right at that moment, and for me it was a struggle because I supposed to feel happy and full, but I wasn't feeling that, and as soon as I make the switch to bariatric surgery, everything changed. So I can be in the OR 24/7. I can be in the OR with a lot of cases, and fortunately I have a family and I have two kids, so that's a reminder that I have to stop working long hours. But with bariatric surgery, there's a whole new dimension for me. I can be lost in the OR, and I can be lost in time.
Yeah.
So yes.
So with bariatric surgery, and also I wanted to just your transition to bariatric surgery and what you have created now. Can you tell us a little bit about, for people that don't know, what your clinic does, what the process is for people coming to have surgery in Mexico?
Yes, well, we're a clinic that are located in Tijuana, Mexico. We're specialized only in medical tourism patients. So I think around 99% of our patients are medical tourism patients, mainly from the US and Canada, but we also have patients from Europe, New Zealand, but most like, but the grand majority is U.S. and Canada patients, and it was like giving U.S. patients and Canada patients that opportunity that they don't have in their home countries based on health systems. At the end, I do understand that the health system in the U.S. is run by insurance companies, and sometimes it's very hard to the patient to be able to have the treatment of obesity. So in our clinic, we focus and try to help people, but with the same quality of care, in the same quality of protocols, of safety protocols. So we're really proud that our center is a center of excellence. We are in bariatric metabolic surgery by the SRC. We are Joint Commission International Accredited Hospital also. Obviously, all the physicians that work in the hospital are board certified. So we are very thorough with our protocols. And a lot of colleagues of mine call me obsessive. I don't care. I think I have to be obsessive in this kind
Be
of, yeah,
obsessive.
yes.
I appreciate it. Yeah.
Yes. And the whole point of doing this is, number one, doing what I love. That is surgery, that is bariatric surgery. But and the other thing that if in that world, me doing what I love, if I can help people achieve health. So that was my main motivation. So basically, it's a bariatric medical tourism program that we focus on safety protocols. We focus on excellence, and our results are published there that our complications rate are below literature complications. Our fatality rates are also almost zero in 17 years. So we're very proud of that.
It's one of the things that very first, when I was doing my research to find opportunity to have my surgery in Mexico, which I just wanted to say that I was one of those people that I couldn't get surgery in the U.S. because my insurance company wouldn't cover it. And I work for a hospital, and they are self-funded, so they're the ones who decide what is covered and what isn't. And they decided that bariatric surgery wasn't covered. So I looked for my opportunity in Mexico, and when I found that you were a member of the ASMBS, that
Correct.
I was so surprised. And then, then you are Joint Commission. That's another accreditation body for people that aren't aware. But those are American accreditation bodies that I mean, how I didn't see a lot of other surgeons or a lot of other programs in Mexico. And I was looking in Tijuana. I don't know about other places, but how common is it for bariatric programs in Mexico to have those designations?
It is very uncommon. So unfortunately, hopefully, all my colleagues here in town, I do advocate to those programs to be accredited with international accreditations, because at the end it builds confidence for patients, but most important, it builds those protocols of safety that in surgery we cannot guarantee an outcome, but the thing that we can guarantee as surgeons and as a center of excellence is that we're going to be applying those rigorous safety protocols. In that way, we can minimize the risk of any complication as low as possible.
Yeah. I do think that it's important for us on the patient's side to do our homework and to make sure that we are choosing places that are safe and, surgeons that are skilled and have integrity. But the other thing that is also, you mentioned, that the quality of care would be one of your goals was the quality of care would be, similar to what we get in the United States. And I just have to say that again, from my own experience and that of my family and most of my friends, that the experience that I have had in Mexico in your clinic, and I have brought friends to your clinic for bariatric surgery as well. My coaching clients I have brought. The experience that we've had was so much better than what we have experienced in the US. So you have exceeded that goal of yours in providing a good experience, not just safe, but really cared for. It's really the first time that we have felt what true health care is. You see us as a whole people, not just a surgery. So what what I experienced where, the clinic cares for us from the time we land. The plane lands in San Diego, and as soon as I turn my
Right.
phone on, I've got a message from someone who's coming to pick me up.
Yes.
That's just that's just the first thing. There's excellent communication, and I just how did you put all of that together? How did you come up with this plan to care for people from the very beginning all the way through?
I think that I managed to do that, putting myself in our patients'
Yeah.
feet. So that's as soon as we empathize with our patients, and actually I did go the whole trip. I did do the simulation of the driver picking me up in the airport, driving me to the hospital, see the physicians, the nurses, all the staff. And actually, I did it with myself, and I did it with friends and family members that the staff didn't know that they were my family,
Nice.
they were my friends.
Great
So,
shower.
so I like to, yes, just make the drills and make sure that I finish perfect. and just try to control the scenario, because I understand US patients or Canada patients are coming to Mexico. Sometimes it's the first flight out of the country. And I can relate that coming out of the country to Mexico, uh, it can be a frightening experience to think about. And the thing is that I want to build those bridges of confidence way before the patient makes the decision to come down here to Mexico. And at the end, if we are realistic, sometimes Mexico doesn't have the best PR internationally, especially Tijuana. But at the end, as any major cities in the world, you have dangerous areas, you have safe areas, and the whole thing is to do all in-house staff, starting with the drivers, with X-rays, starting for the lab work. Everything has to be in-house, so that way I'm sure that the patient is going to feel safe. So that's the main thing.
Yeah. And the hotel, it seems like, again, when we arrive at the hotel, the driver helps to get us checked in, helps us, make sure that everything gets to our room and that we're settled in the room. And then, we know what time we're going to be picked up in the morning, or like all of that is just so seamless. And again, we just feel so cared for, and really appreciate that experience. Thank you so much for including
So thank you.
the spirit and the emotional side of this experience as well.
Yes, and it's all about, at the end, I think I'm going to be repeating myself. At the end, is about safety. Make the patient comfortable, make the patient feel safe. Also, the companion has to be safe during this whole process. And we work really hard to accomplish that, because sometimes there are a lot of issues that are out of our hands, but we try to have plan A, plan B, C, and always focus to our patients' safety and comfort. So that's our main goal, and that's why I did pursue those international accreditations. In becoming, especially JCI and ASMBS accreditations, it was hard for me to obtain those accreditations. A foreign surgeon out of the United States was like almost 5 years process to achieve those accreditations. So my whole team and myself, we are very proud of those accreditations. But at the end, reflects our passion to offer our patients quality of care and quality of safety protocols.
Safety, like you mentioned, is sort of one of those myths, I'm going to call it, about having surgery done in Mexico and anyway, outside of the US. But what other misconceptions or what other myths are there that you know of that we can just bust up right here?
So it's very important for a patient to make the research, because like in the US, we have here in Mexico, we have great practice, we have great groups, but also we have a lot of teams that they don't put a lot of attention of those safety protocols. So I think my best advice is like you did when you were a patient, is I do advise our patients to do the research. At least the surgeon has to be board certified in bariatric surgery, because there's a lot of general surgeons performing bariatric surgery, and there's a huge difference being a general surgeon than a bariatric surgeon. And that's, as for starters, the surgeon has to be board certified. But that is not enough. The surgeon needs a team. And like Michael Jordan says, talent wins games, but team wins championships. So it's not only my work; it's a team effort. I'm very lucky enough to be surrounded with great physicians. So my advice is for the patients looking for bariatric surgery in Mexico is, first of all, you have to be sure, and don't be afraid to ask these questions. Number one, if your surgeon is board certified, make sure that the surgeon that is advertising surgery is the surgeon that is going to be performing the surgery, doing surgery, because that switching bait is very common also. Be sure to ask if the surgeon assistants are also board certified bariatric surgeons. That's very important question to have in mind. Third question that I think is mandatory is, who is going to be your anesthesiologist. It's a general anesthesiologist. In our case, it has to be an anesthesiologist that is specialized in bariatric anesthesia. That's very important also. So sometimes we don't ask those questions and we only rely on the surgeon. The surgeon is board certified. Everything is going to be fine. No, that's incomplete. So obviously the surgeon is it has to be board certified, but that's not enough to be able to offer that safety protocols in that safety environment doing surgery, previous, during, and after surgery is all about the team. So my best advice is to tell your audience, to tell the patients you're considering having surgery in Mexico, to ask those questions. So surgeon assistants, anesthesiologists. And also very important, I think the fourth important question is where the surgery is going to be performed. So because the center or the hospital has to be specialized for bariatric surgery also. So that's so if you have a board certified surgeon, but the team is not qualified and the hospital is not qualified, so there's always a risk of complications, even if the surgeon is very talented.
Wow. I mean, that is new information for me too. I love that. Thank you so much. One of the other, this is my favorite myth to bust up. And that is it's perpetuated in the US that if I have bariatric surgery or if I have any procedure done in Mexico, that no other surgeon, if I have complications once I get home or something, no other surgeon is going to want to touch me. And I want to just say that, again, I've worked with a lot of surgeons, and what I know is that it doesn't matter if the surgery is in Mexico or if it's in the next state over or if it's down the street in my same town, that in the US, surgeons don't like to follow other surgeons. They only want to perform surgery on patients that they have performed surgery on, or if it's a new surgery. So I know that it doesn't matter that it's been done in Mexico, but it is interesting, and I have heard this question a lot. What happens if there is a complication? What happens if patients have questions or something happens once they get home?
Yes, that's a very important question. So that's why we have a special protocol that we leave our patients 48 hours after surgery. So, and you being in the health industry, common practice in bariatric surgery and in other surgical specialties also is that sometimes the patient is discharged the same day at surgery. And that's not malpractice. Even the ASMBS has accredited those as a safe practice. But in medical tourism, that's a luxury that I cannot take because since my patient is coming for a foreign country, if I discharge my patient the same day of surgery, is a lot of ifs that I don't have control. And statistically, 99.9% of complications happening after bariatric surgery occurs the first 2 days after surgery. So me having the patient 48 hours after surgery, we covered that 99% of risk of complications. If I pick up any complication during that frame time, obviously we will deal with it and we will fix it. And the chances of having any complications afterwards is less than 1%. So it can happen. If that's the case, me being an ASMBS accredited surgeon, and also I'm a fellow of the American College of Surgeons, that builds confidence. So I can talk with surgeons in the US. And they feel comfortable talking with me because they feel they're talking with their peer, having the same accreditation. So I think that's one of the advantages that I see having international accreditations, that it makes me closer to my peers in the US and Canada also. So in that way, I have be lucky enough to have great friends in the US, and we share a lot of stories, a lot of cases, and we have learned to be a big community. And you will be surprised, DeDe, that a lot of U.S. surgeons are very receptive. As soon
Yes.
as they feel comfortable with the surgeon in Mexico, and we talk with a real person to person chat in with respect and in having that surgeon talk, you will be surprised. I think most of US surgeons are gentlemen. They are very receptive and they are willing to work with patients that are treated in other places.
In the little town that I live in, there isn't a bariatric program. The closest one is over the mountain, a couple hours away. And before I had my surgery, when I was putting together my team and I was having conversations proactively with my primary care doctor and all of that, there is a surgeon at my that is a fellow of and has did bariatric surgery. And so I actually went to him and said, I know you don't do it now, but if something happens afterward, would you be willing to take care of me? Would you be willing to have a conversation with my bariatric surgeon in Mexico? And would you be willing to? I just wanted to put that whole obstacle to rest to the extent that I could beforehand, have all of my bases covered. And he was very receptive. He was very receptive. He's like, absolutely. So, to the extent that we can, the hospital that I work at, because we don't have a bariatric program, the hospital wouldn't be able to, support it or whatever. But as a general surgeon, he said he would do everything that he could to help. And I think that's one of the things that I coach my clients to, is to have some of those conversations ahead of time. If you have relationships,
Right.
if you have a good relationship with your family doctor, if you have a good relationship with any of those people that may end up helping you afterward, have those conversations ahead of time if you
Right.
can. So
Yes, you will be surprised of the outcome. Sometimes we're expecting the worst, and the great majority of the times, the surgeon or the physician is.
absolutely. For practice now, I mean, you have come so far. And again, those accreditations, I know that they are difficult and very stressful for programs in the US, much less for programs outside the US. But what
Sure.
frustrates you most about how bariatric care is delivered now?
In the US or in
Well,
Mexico
let's just
or
say,
well,
either, but I'm especially interested in the US.
I think this the stigma of the word obesity. Sometimes I think that that's the most hard part to deal with, because we have to recognize that obesity is not a choice. Obesity is not a lifestyle. Obesity is a disease. It is like diabetes, high blood pressure, or cancer. So sometimes as a society, we're very easy to point at it's your fault, it's your lack of will, it's your lack of activity. You have to do your diet and do exercise, and that's going to be it. It was as simple as that. There wouldn't be obesity in the whole world. So obesity is a pandemic. Obesity is a disease, a chronic, recurrent disease, and it's a very hard disease to treat. So obviously the best option currently is bariatric surgery, but also if I think that we manage to make that switch of that mindset of obesity that is the patient's fault. I haven't heard anyone fault the diabetic patient that it's your fault that is your diabetic. I never heard anyone says it's your fault that you have stomach cancer. And it's very common to end up making those assumptions to the obese patient. So I think that's the hardest part to break. Fortunately, as a society, we're getting in that place that we're realizing that obesity is not the patient's fault. So a lot of misconceptions is that why do bariatric surgery if five years from now you're going to be regaining weight? So for me, that's not a failure. For me, it's a recurrence, because, like we said, obesity is a chronic, recurrent,
Yes.
complex disease, but it's treatable. how we treat it with surgery. That's the best option. We have medications that if we combine surgery with medications, that's the most magnificent match you can imagine. So, obviously, I know that GLP-1 drugs are very, very popular right now. But don't get me wrong, they're very excellent drugs. But sometimes medication alone is not going to be enough. But if we can manage to understand that medications is only another tool to help the patients to achieve obesity control, I think we're going to be succeeding in several years now. So I
Yeah.
think that's the
And
most important part.
again, I just am going to put a little shout out to your Facebook content, because you recently, I think I saw a post that you did where you were talking about people saying that bariatric surgery is the easy way out, and it absolutely isn't. And every guest on the show has mentioned that it definitely isn't. But there are some tools available to help us. And one of the things I
Right.
really appreciated learning from you early on is, so I personally had the sleeve, and the thing I wanted to start with that, and I appreciated your recommendation for that, because it's really the least I don't want to say invasive, but there's no rerouting of my intestinal tract or my
Right.
digestive tract. It's just very simple, I guess. I don't know another word, but it also leaves so many other options open. If for some reason I have a recurrence after
Right.
the sleeve, there are still options. It's not a one and then if it
That's correct.
fails, if it
Yes.
fails, I have failed. There is no failure. There is just, like you say, there's
Correct.
recurrence, and there's an
Recurrence.
opportunity for
Yes.
another step, and there are
Recurrent.
more steps available. So I really appreciate that. And
Correct.
you have highlighted that in some of your new content. The other thing I wanted to say, and I know that some people get a little squeezy seeing some of your content from the OR, but I personally love it. And you recently showed, I really appreciated, you were talking about why it's important to do the pre-op diet and what that does to
Correct.
shrink the liver, and why that's important for you as the
Yes.
surgeon. And you showed what a really healthy liver looks like during surgery, and how that makes it so much easier to access the stomach that you're doing the surgery on. And I loved it. I loved it.
Thank you. Thank you for that. So obviously, the whole point of uploading
Yeah.
that type of content in the OR, and always careful to put discretion advice, because I know that
Yeah.
some people are going to be a little bit sensitive. But the whole point is to inform our patients, and you know the saying, at the end, knowledge is power. So it's more power for our patients to have that kind of information. And you're correct. You're going to be noticing that a proper bariatric program is going to put you on the pre-op diet before the procedure. That's very important, because it's going to prepare the patient physically. It's going to shrink the liver. That's the number one indication. It is going to make technically the job a lot easier for the surgeon. But also, we have to, and I do tell this to my patients, the less I touch your liver, it means less pain in the post-op immediately. So it's going to be a win-win situation. Not only you're helping your surgeon, also is going to help you to have a better outcome and a very smooth recovery after surgery. And also, it helps with inflammation in the fatty tissue inside of the abdominal cavity. So it is a lot of positive impact doing the pre-op diet. And that's also, be very careful if your bariatric program doesn't offer you a pre-op diet or a preparation before surgery. I think that's a red flag. So you should ask for those kind of preparation before surgery. And yes, even if it is the sleeve, the bypass, the mini gastric bypass, the pre-op diet is very important to do. We're going back to the original question. A lot of people that doesn't know what it's all about bariatric surgery, especially the haters one. I'm going to tell you, you took the easy way, you had surgery. I think it's quite the opposite. Starting for the pre-op diet is hard to do. I know it's hard to do it. The fasting that the patient has to do before surgery is double, triple the effort. And surgery by itself is going to push the patient to change habits. And that's going to require a lot of effort from the patients. But I can guarantee you that all that hard work that you're going to be putting on is going to pay off. Obviously, it's not the easiest way out. It requires a lot of effort. And I think that the easiest part in the whole process is for me as a surgeon, because obviously I have to make sure that I did a proper shave technique, that I did a safe environment doing surgery. But at the end, my work is going to take a couple hours, and that's going to be it. The rest of the work is entirely up to the patient, and cheers up to the patients, because it's hard to do it. Even with bariatric surgery, if we go back to the basics, obesity is a chronic disease that is very complex, but it's treatable. In two thumbs ups of all the patients that are post bariatric, that I know the struggle. And I do say this with a lot of humility. At the end, all the hard work is for the patient. I think the easiest part is for me as a surgeon. The whole point is to make feel the patient that they're not alone in these journeys. We are very thorough with our patients' follow up. Obviously, it's going to be telemedicine, but at the end, we are just an email away, a phone call away.
I know that the follow-up is huge. I mean, preoperative education is really important also. And I think that your program has really enriched that process, even since I had surgery, which has been 7 years ago now, that you've really made
Correct, yeah.
even more changes. And I think that education period is absolutely critical. In fact, I think it's required by ASAMBS. But the follow-up care is also really important. Can you talk about how your clinic approaches that pre-op education as well as follow-up education and support?
Yes, so it's very important. That's the importance. So that the surgeon has a team in the follow up, in the education on the pre-op process. Basically, is between nutrition and our pediatric physician. Obviously, the most technical parts, if the patient has a lot of doubts of the procedure, if they have a lot of doubts of particular technique that the patient do want to be performed, I'm always open. My schedule is always open to talk with the patients. But I think around 90% of all the information between our nutrition team and our bariatric physicians teams, they can cover all the most common questions. And we are really thorough, once again, almost obsessive in that process, because that information prior to surgery and that follow-up after surgery is as important as the surgery itself. So that's I'm going to repeat, is as important as surgery itself, because we have a lot of problems here in Mexico that they don't have those follow-ups very very organized, and don't get me wrong, they're excellent surgeons, but at the end is not only surgery, is the whole treatment as a unity. So if one of the pieces is missing, most likely we're not going to be having the outcome we want
All
for
of
our
that
patients.
support from all of those experts, really, the nutritionist, dietitian, I mean, guidance in fitness, guidance in and emotional wellness. I mean, they talk about, you can do surgery on the stomach, but you can't do surgery on my brain and my emotions, and all of that is my responsibility. And I needed myself for mine. I found a team on the US side that could help me process all of the stuff that comes up when I've just now eliminated my favorite coping mechanism, and bariatric surgery has limited my ability to eat my feelings away. How do I deal with those? And how do I, make sure that now that the volume that I can consume is severely restricted, how can I make sure that what I am eating is as nutritious as possible so that I am feeding my body what it needs? And all of that is as important as the surgery itself. And I think becomes really obvious
Correct.
after surgery.
Yes, and we have to be working in that mental area, because at the end, I tell my patients after surgery is going to be a daily struggle. It's going to be a mental game. Sometimes your mind is going to play you tricks, and sometimes you're going to feel a little bit down. Sometimes you're going to be feeling very hype, and we have to be working in that middle area. And if we manage to do that with our patients, you will be surprised the outcome. You're the perfect example. 7 years after surgery, and you look great. You look healthy, and I know that it's haven't been easy for you, because it's a daily struggle. Even myself, I did put a little bit of weight several years ago. I almost had surgery myself. I was at that point, and obviously my
Yeah,
team
of
was
course.
going to be
Yeah.
performing the surgery on me. But I did tell what I tell my patients: give yourself 6 months, and you're not able to lose at least 10% of your excess weight. Don't fool yourself and do surgery. That's the best treatment. That's the best option for treating obesity. I did manage to lose the weight with only diet and exercising, but I do know that I'm that area, then that risk that eventually maybe I'm going to regain a little bit of weight. If that's the case, I'm going to be having surgery, because I do believe in this treatment, and I do believe it's the best option to treat obesity. For me,
Yeah.
it's a daily struggle also. I can tell you till this day how many days I haven't drank any Coca-Cola. I'd rather be off that, because I know I'm not going to be able to restrain myself
Yeah.
if I drink only one glass of
Yeah.
Coca-Cola.
Yeah.
So I just try to avoid it. So that works for me. So every patient is unique, and every patient is going to be finding their own formula to make it work. I know the struggle. I know that it's hard, but a little bit of effort with proper treatment and proper guidance and proper support.
Yeah.
That's the most important part. If the patient has support, most likely the
Yeah.
patient is going to be doing very
And
well.
so I didn't know about your Coca-Cola addiction, but what about you still do
Yes.
still do your squats in
Yes.
the OR?
Yes, I still do. I managed to do those
Yeah.
micro sessions or exercising. So I tend to do that every hour. So I do have an alarm, and obviously, if I'm in the OR, I'm not
Oh,
going to be
right. No, but
stopping or pausing the surgery and I'm not going to do that. But if I'm doing rounds or in the hospital, yes, every hour I have an alarm, and I do micro sessions of exercising, and I try to do at least 3, 4 times a little bit of boxing on the week. And I try to eat everything. I don't restrict myself of any, but I do see my portions, and at the end,
budget.
it's like a financial, how you, yes, it's how you manage your financial budget.
Yeah.
So you have to
Yeah.
make sure that your
Yeah.
balance is
Yeah.
is,
Yeah.
is positive. At the end, I can relate with my patients, and I know it's a struggle. I know that it's hard to do, but with a little bit of guidance, a little bit of support, and I have a lot of support from my team, from my family, even from my patients. I do receive a lot of private messages that keep up, Dr. Illan. You're doing great.
Yeah.
Don't stop doing exercising. Keep watching what you eat. And
Yeah.
my secret was leaving Coca-Cola. As soon as I managed to do that,
That's great.
magic happens.
Last thing I kind of wanted to explore with you, I'm really interested to hear your thoughts about kind of the future of not just bariatric surgery, but medical tourism as well. Where do you see it going in the next 5, 10 years, even?
I think that the tendency is that medical tourism is going to be growing a little bit. The ASMBS did show us the surgery numbers from last year. And statistically, the ASMBS told us that we're performing bariatric surgery only in the 1% of
Mhm.
obesity patients in the US, only in the US. So we have 99% of obesity patients that they're not having, or they're not able to have the treatment, surgical treatment. So I think medical tourism is that an option. Obviously, the patient has to do the research. Is very important. I always advocate that the patients do the research. The beauty of this days that we have all the information in the internet. Yes, you just can Google it, and everything is going to be there. Just look for the good, the bad, and the ugly, and just make your informative decision. And regardless what decision you take, as long as it's based on quality information, you're not going to be wrong.
It sounds like, and I'm not surprised that medical tourism in general, but even bariatric surgery specifically, that there really is a lot more on the horizon for opportunities to get support and treatment. Yeah. Um, I'm
Correct.
curious
That's
too.
correct.
Do you think there's, for bariatric surgery in general, I know you use the robotics, and what kinds of what do you
Mhm.
see in the future in your OR in the next 5 or 10 years?
Definitely robotics. Yes, I see robotics in the OR. Even I think that closer than 5 years, I think that robotics is the next generation, is the next thing. It depends on the technology. Right now, the technology of robotics haven't
Mhm.
been superior to laparoscopic approach in bariatric surgery. In other specialties like urology, robotics has a lot of advantages. But in bariatrics, right now, robotics haven't proven the superiority with laparoscopic surgery, but eventually technology is going to catch up. And I think that sooner than later, I think the technology is going to get at that point that is going to be superior than laparoscopic approach.
I just recently learned about, and I'll see if I get this name right, endoscopic gastric surgery. So, and it's all just
Yes,
endoscopically done from basically from the inside. What
that's
about
correct.
that? Tell me your thoughts about that surgery.
That's correct. That's another option. And this endoscopic surgery has been in the spot for the last several years. But at the end, I think the current GLP-1 drugs are showing the same results that endoscopic bariatric procedures. So I cannot tell the future of endoscopic. At the end, is other options. The beauty of it is that we have more options. But if we compare the endoscopic sleeve versus the traditional sleeve, the laparoscopic sleeve, data have shown us that the traditional sleeve is a little bit superior than the endoscopic sleeve. I think that the endoscopic sleeve is a perfect option for a small niche of patients. That number one, they don't want surgery, that they're scared going to the OR. For me, that will be the number one indication. Number two, that the patient, depending on the medical background, maybe is too dangerous to be under general anesthesia, or maybe it's too dangerous to be putting insufflating the abdominal cavity to perform surgery. So maybe that's going to be the endoscopic sleeve place. So I think that there's a niche for that procedure. But at the end, I think the traditional bariatric, laparoscopic, or even robotics bariatric surgery is a little bit more superior than endoscopics. And most recently, the new drug Monjaro has shown that it has the same rate of success than the endosleeve. So at the end, the patient is going to be making that decision. Do I want to go into the, even that it's not surgery, it's going to be endoscopic, but also maybe you can have a weekly shot, and it's going to give you that same results. So for me, it's going to be a very easy decision for the patient. Sometimes the patients opt for the medication instead of an endoscopic procedure. But don't get me wrong, it's a great option for, but it has to be indicating for the right people.
All right. I know that we are coming up on an hour, but I have two really quick things that I wanted to one of them is the confession that I'm a little bit worried that your popularity is growing. And are you going to be so busy that you can't, that it's too difficult to get in and get surgery? Because usually it's really easy to, once I decided I was going to have surgery and I wanted Dr. Illan to do it, the process went very smoothly, but also pretty quickly, especially compared to the US process. Are you at a point where you can continue to build your team and build your availability as the need grows?
Yes. So the beauty of our team is that we have been working for 15 years now. So that's the great thing that I don't believe of rotation of the personnel that is involved in the OR. So I'm lucky enough to be working with the same team for the last 15 years. We don't have to be we don't have to talk anymore in the OR, just a quick look and everyone knows what to do. So it's like I have been having the same dance partner for the last 15 years. So we know the rhythm, we know, and for me, I trust my team so much that I wouldn't pick another team to perform my surgery personally. So like I said, in surgery, I always have two assistants. The doctors are also board bariatric surgeons like myself. And at the end, my colleagues, they're able to do everything I can do in the OR. The only thing that they're not out there in social media, but it's skillful. They're very ethical. They're very professional. And as a team, I think that we are going to be able to manage the volume we could have in the future.
So last question is there anything that I haven't asked you that you want people to know here? We've covered a lot, but good.
Yes. So I think that at the end, I want to tell the patients or audience that you're not alone. Obesity is not your fault. You're not alone. There's options. Obviously, obesity has a percentage of recurrence. Don't feel discouraged. It's very important to have that support. It makes all the difference, not only for your health team, also from your friends, family. If you don't have that kind of support, you can look for support groups, and it does make the difference. And at the end, even if you're not my patient, the support group is open for everybody. So I think that the best comment I can give your audience is that you're not going to be alone, that we understand your struggles, and that together as a team, most likely we're going to be making a great outcome. I think that together we can succeed. So I think the most important part is that if you're not alone, if you have that support, the chances of failing are very
really
slim.
Is no failure. It really just the next step, right? And I love your quote from Michael Jordan. And really, it is calling in your team, recognizing that you do have a team. There are people that want to come in and support you and really help you be the champion.
That's correct, and that's very important. Just don't be shy, and ask this direct question. So I know you're board certified, but who's your team? Who's helping you? Who is your anesthesiologist? Show me your anesthesiologist credentials. Who are your assistants? Show me your assistants credentials. Where you perform surgery, please, can you give me the hospital credentials? Don't be shy to ask those questions. As a patient, you're entitled to know that kind of information. So it's crucial to have.
Just also quickly mentioned that there's a dental clinic. It's new, and I am so excited.
Yes, that's correct.
And I hope to be coming down and checking it out personally. And and in fact, I'm working with that team to get my mom in. So hopefully my mom and I can both come down, and we're looking forward to checking it out. So I'm just curious, is it part of, I know it's part of Hospital BC, correct?
Correct. Yes, that's correct. And the odontologists that are managing the dental area, there are a couple. They're married, so they're very ethical. Also, they're beautiful people, and actually, I trust them so much that they're the physicians that did my teeth work a couple of years ago. They also did several of my family members' dental work. So they're very skillful also, and that was a very uh, uh, I was trying to make that a 360 wellness package to our patients that we're offering right now. Bariatrics. Also, we have a team of plastic surgeons that are specialized in post-bariatric patients. And I think that cherry on top of the cake is going to be dental work. And also we have a spa that maybe the patient can be
I'll be
relaxing a
checking
little
that out
bit.
as well.
Of course,
Yeah,
you're
and
more than welcome.
actually, I wanted to just to I'm sorry that I didn't ask about the plastic surgery side of the practice, because again, that came up in conversations with my previous podcast guests that have had plastics done there, and I just, it's so incredibly important for people to recognize that plastic surgery for bariatric patients is not the same as just a general plastic surgeon that does.
That's correct.
It's kind of like a generalist, but really for patients that have lost a massive amount of weight, it really is more of a reconstructive procedure than a cosmetic one.
That's correct. Yes. For me,
Yeah.
plastic is reconstructive surgery. Yes. Yes. And not every plastic surgeon had that knowledge and that that kind of treatment to perform post-bariatric plastic surgery, because it requires a lot of experience in those type of procedures.
Thank you so
Yes.
much. I so appreciate your time. It's past the hour, so I want to just be mindful
It's my
and
pleasure.
respectful of your time. But I hope to see you again. I hope to chat with you again and introduce more of my
course.
clients to you, because as I help them make good decisions
Thank
and
you.
prepare them
Thank you.
for surgery, I just have appreciated you taking such good care of all of us.
Thank you so much. And DeDe, just want to acknowledge you and tell you that I really appreciate you. And the thing that you're doing right now with the podcast, and maybe you're not realizing this, you're touching a lot of people's souls. You're touching a lot of lives, and I'm very proud of you that you're passing your knowledge and you're supporting the bariatric community, and maybe you're not realizing this, but you're touching a lot of people's lives. So congratulations for the postcats, and it's a pleasure to be in here, and thank you for having.
I hope you enjoyed that episode as much as I did. I really appreciate Dr. Illan and his passion for helping patients. I really appreciated hearing his story about why he got into bariatric surgery and how he made the transition from his residency of plastic surgery into bariatric surgery. I appreciated that it was really passion driven and that passion continues for him today. I also was surprised, I don't know why, but I was surprised that 99% of their practice is a specialty of medical tourism for bariatric patients. I knew that a lot of bariatric patients came from the US and Canada, but I didn't realize it was such a big percentage, as well as Europe or patients, that is, from Europe and New Zealand as well. I really appreciated his perspective on the stigma of obesity and how that's really a shared passion of ours in combating that stigma. It is a a disease. It is not just a choice. It's not just about genetics. It's not just about a lifestyle choice. All of it goes together, and it takes a team. I'm really glad to hear that he's got a solid team that he works with and he trusts, and they have been together, working together for such a long time. That really speaks to the solidarity and the trust and the safety that they bring to us. I also appreciated his take on the future of both bariatric surgery and medical tourism in general. So tell me in the comments what you thought of the conversation, because I'd really like to hear also anything that you're interested in covering regarding medical tourism in general. So let me know. What do you think? What shall we cover next? If you're considering bariatric surgery or are navigating life afterward and feel like you could use some support, I would love to help you. I had bariatric surgery over 7 years ago and am also a national board certified health and wellness coach. I've also got over 30 years of experience working in hospitals and medical clinics in the US, so I get it. If you'd like a discovery call with me, all you need to do is tell me a little bit more about yourself and your journey at the link in the podcast description below. And I've also got some other resources there for you, so be sure to check it out. Remember, being well in this era and in this culture, it's an act of rebellion. So go, be a rebel and be well. Until next time.